I just want to say that I'm extremely honored to become president of Michigan Radiology Society for 2011 and 2012. I really am very privileged and extremely humbled to be nominated to such a position by my colleagues in the society, and I'm very, very grateful for all the support. You know, having been in the audience on many such occasions, I can honestly say there's no substitute for brevity, so I'll keep my comments to a minimum, but I have to say something, right? So, the legacy of success of the MRS is based on the contributions of numerous individuals who have served and continue to serve on a voluntary capacity. And I really don't consider myself a leader, but rather an individual who's just going to assist the board of directors. So again, thank you for the opportunity. All of us that have been longstanding members of society are very familiar with the numerous accomplishments of the MRS. Over the past year, under Rojan's leadership, the society has worked cooperatively with MSMS and the state legislature to ensure that diagnostic imaging studies will continue to be performed by medically trained specialists specifically trained in radiology. Our proactive approach over the last year has helped ensure the citizens of the state that their imaging studies will be performed by physicians who have the highest professional qualifications for image interpretation and radiation safety. The success of MRS is excelling at our multifaceted mission has been recognized at the national level. And again, under Rojan's leadership over the last year, the MRS was recognized at the recent AMCLC for both excellence in education and in meetings. I think we all feel that radiology is under attack. However, despite these challenging times, I do not think that there's a more intellectually stimulating and rewarding profession than our subspecialty. And I personally would make the exact same choice that I did 20 years ago regarding my career. And I have to, David Bloom is in the audience here, and David and I were residents at the Brigham between 88 and 92. And David, I hope you feel the same way I do about that as well. However, what has really changed, at least in my opinion, is that the interdependency on each other. Now, 10 years ago, we probably viewed each other in the room as potentially competitors. However, now we have to be collaborators. We're not going to be able to sustain the long-term success of our subspecialty unless we work together. And I think that really is a pivotal role for MRS in establishing this foundation. So how do we get there from here? You know, I would like MRS to be recognized as a society that represents the interests of all radiologists in the state of Michigan. Would also further extend the reach of our society to include more of the Upper Peninsula, to extend the Western Michigan, the Mitt, and the Thumb. And in order to do this, we have to give a reason for radiologists to turn to MRS for information and solutions that can affect their practice. MRS has continued to perform excellent work on the legislative, educational, and clinical fronts. But in my opinion, the challenge has always been in communicating what we are doing to other radiologists in the state and how we can help and how we can work together. Over the next year, I'll work actively to enhance the content of our website and with legislative and educational updates on the Patient Protection and Affordable Care Act and the changes in the RUC deliberations regarding RVU weightings. We'll also work diligently to help identify content which will identify opportunities for dose reduction and enhance radiation safety. The MRS is also currently testing options for improving our teleconferencing for both our board meetings and improve our webcast technology. And Shannon did an outstanding job. You probably got all those emails from Shannon telling you that there's a meeting tonight and everything's being webcasted. So for those of you in cyberspace, if you're out there, hello, we're glad you're here. Okay? We'll all be working very hard to achieve these goals over the next year. However, we do need your help. And the only thing that I would ask of you in the audience is what I would like you to do is just talk to 5 radiologists that are not members of MRS and tell them and encourage them to join MRS and what we can provide for them. And this is especially a plea for the residents, because the future of this society is not old farts like me. It's going to be the young individuals like you. And we have to have your foundation in order for us to be successful. And that concludes you, Natasha. Okay? All right. One area of collaboration and growth is with our colleagues in radiation oncology. We're both primarily hospital-based physicians and share a similar pedigree and similar board certification. In fact, the current president of the ABR and the chair of the board of directors for the RSNA are radiation oncologists. And I think we should share a similar tight collaboration at the state level as is at the national level. So during the next year, I'll make a concerted effort to reach out to the radiation oncologist and identify how we can better meet their needs. So in conclusion, finally a conclusion, right? I really consider it a tremendous honor to become the 90th president of the Michigan Radiological Society. And if I am correct on this, I think we probably have the oldest, if not the the most prestigious society in the country. And for me, it's a tremendous honor. Our team is all, go ahead, okay. Our team is already hard at work and have begun planning for next year. We've already identified tentative dates for next year's board meetings, and we're considering topics for the June, the Hickey, and the fall meetings. So both Beer and Shaw and I would really welcome your feedback for topics and speakers, as we wish to ensure that the content of these lectures are relevant to your practice. So in summary, thank you again for the honor of being your president. And I really sincerely mean this. I really look forward to the privilege of serving each of you over the next year. Thank you very much.